Welcome back. I'm here with Dr. Sherry Tenpenny. Dr. Tenpenny, is a thermogram a standalone test for breast health assessments?
Thermograms are a standalone test for breast health, but they should never be a standalone test if you're trying to identify disease. It really is a function of your physiology, and it is meant to be used in association with mammograms. However, in my opinion, I believe that mammograms should be used as a diagnostic tool. When you get your mammogram report back from your doctor, it will say right across the bottom of that report that mammograms have as high as a 25% false negative rate, which means that you may very well have cancer, but that the mammogram has not been able to identify it. That's what a false negative rate is. For thermography, historically, over the hundreds of thousands of thermograms that have been done in the last 25 years, there's less than a 3% false negative rate, meaning that if you have an abnormality there and it is cancer, it will be identified 97% of the time, where mammograms will only identify it 75% of the time. Even with those types of statistics, I think it's very important for women to use both tools. However, if you have a thermogram and consistently year after year after year you are scored in a Th1 or a Th2 level, which is the lowest possible score, I don't necessarily think that it's important to get a mammogram every single year. Perhaps every 5 to 7 years, as long as you're consistently getting a thermogram and a very highly educated breast exam by someone who's been highly trained.
Are there foods or supplements that are more important for breast health?
There really are. One of the main supplements for breast health is iodine, and we can get iodine from eggs, particularly egg yolks. We can get it from seaweeds and sea vegetables and kelp, because it's been known since the 1960s that areas of iodine deficiency inside of the breast tissue are areas that frequently coincide with the development of breast cancer, particularly in the ducts. So iodine is really important for breast health. In fact, it requires about 150 micrograms a day to keep your thyroid healthy with iodine, and it requires about 3,000 milligrams a day to saturate the breast tissue and to keep your breasts healthy using iodine.
Dr. Tenpenny, will you tell us a little bit more about Tenpenny Integrative Medical Center?
Tenpenny Integrative Medical Center is located in Cleveland, Ohio. We've been here since 1996, and I'm always proud to say that we've had people that have come from nearly every state and more than 14 countries to get well and to get off of their pharmaceutical drugs. We focus on women's health and breast health. We do allergy elimination types of programs that can get people so that their sensitivities to allergies can go nearly completely away, and in many cases 100% away. We have osteopathic physicians, chiropractors, and acupuncturists, so we do a very large pain program in our practice. And we are very happy to have all of these different people come from all over the world to join us to get well and celebrate their health.
Dr. Tenpenny, can you tell us more about why you've become so passionate about thermography?
I've become very passionate about this since we've been using it in our center since 1996. Once I started looking at the background information and I looked at the historical backdrop and all of the research and science that was done and continues to be done this day, it made me very sad to think that this was a tool that could identify much earlier the condition of health or dis-ease in a woman's breast and offer them a window of opportunity to get healthy and to restore the health to their tissues before they proceeded on to having cancer. We've had many women in our clinic here in Cleveland, Ohio, that when they would get a thermogram, it would be a level 4 or 5, which would be identified as high risk. We would then appropriately order a mammogram. The mammogram would be negative, but we knew that they had a high-risk condition in their breast tissue. And by offering them supplements that were good for their breast tissue, helping them to lose weight, change their lifestyle, get off of synthetic hormone drugs like birth control pills or Premarin or things that were synthetic, changing their lifestyle, doing all sorts of different things that would contribute to breast health. We saw those scores drop from 4 and 5s down to 2s and even in some cases 1s, which is a very great philosophy to say that even though your tissues are having a high risk area of potentially developing cancer, there are ways to turn back the time and restore your body to health. We think about that many times, like if we've had the flu or a cold, we expect our bodies to recover, or if we've had diarrhea, or if we've had some other conditions, infectious diseases. But frequently, conventional doctors don't appreciate the fact that there are many other types of conditions that once we are headed down the road towards disease, that by lifestyle, supplements, dietary changes, changes of your emotional conditions, changing your thoughts, you can restore your body to health. So it makes me very passionate to deliver this out to women, to say there are options, there are ways that you can appreciate your breast health and restore your health rather than just progressing unbeknownst to you onto disease. You know, Angie, there are times, I'm sure there are many women who are listening to this, who they have known people in their family or many of their friends that have gotten their annual mammograms every single year, and then all of a sudden they have cancer in their next year that they get a mammogram. Well, over that 7 to 8 year period of time, that condition has been evolving and could have been identified on thermography and could have been interceded upon. However, we wait each year. We think that we go and we get a mammogram and now we've got this normal thing and we think it's completely okay and we have no pathology evolving in our breast tissue. And then next year we end up with cancer. That cancer did not develop in the last 365 days since your last mammogram. That has been evolving over a multiple year period of time. So that's why it's been stated in the literature that thermograms can identify areas of concern in the breast 5 to 7 years before it can be identified on a mammogram, giving a window of opportunity to work towards restoring health rather than just waiting for that next year's mammogram that could identify your disease.
Absolutely important information for every woman to know. I mean, to understand that you could be preventing this 5 to 7 years before finding out a terrible outcome. Dr. Tenpenny, where can we find places that offer thermography?
Most places across the country the thermograms are offered by integrative medical physicians. These are physicians who are trained to be conventional doctors, and then they've expanded their armamentarium of tools into their practice to include many other things that are not normally offered by conventional medicine. Integrative medicine practitioners can be found on various websites in the internet. I would recommend ACAM, which is the American College for Advancement of Medicine, IFM, which is the Institute for Functional Medicine, ICIM, which is ICIM, which is the International College of Integrative Medicine. Those are some very important websites that your listeners need to know about, that you can go out to the internet, and when you get to their websites, when you get to those sites, they have practitioner locators in them, which means you can put in your zip code, and within 25 or 50 miles of where you live, you can identify an integrative medicine doctor who probably has a thermography unit in his office. And if he or she doesn't, she could probably direct you to someone that's in your local vicinity where you can have this test done for yourself.
That was Dr. Sherry Tenpenny. Stay tuned to WHDT World News. We still have the rest of today's headlines and a full report on the weather. We'll be right back.